Hey everyone! Welcome back again to our vlog. And I think this will be our last video about the autobiography of the drugs because we're at the end of the semester and thankfully we survived this course. So keep watching and enjoy our video which is all about the autobiography of topical antifungal drugs. So enjoy! Generic name and brand names of the drug. First, I have to state the generic name and their brand names. For azole antifungals, we have butoconazole, brand name Gynazole 1. Clotrimazole, brand names are Lotrimin and Mycilex. Econazole, brand name Spectazole. Efinaconazole, brand name Jublia. Ketoconazole, brand names are Exina and Solagel. Miconazole, brand names are Monistat, Fungoid, and Lotrimin AF. Oxyconazole, brand name Oxystat. Sertaconazole nitrate, brand name Ertaxo. Sulfoconazole, brand name Exelderm. Terbinafine, brand name Lamisil. Terconazole, brand name Terazole. And lastly, Tioconazole, brand names are Monistat 1 and Vagistat 1. For other topical antifungals, we have butinafine, brand name Mentax. Cyclopirox, brand names are Loprox. Penlacnil Lacquer, and Gentian Violet, no brand name. Naftitin, brand name is Naftin. Tolnaftate, brand names are Aftate and Tinactin. And lastly, we have andesylenic acid. Brand names are Crux, Desin, Fungoid AF, and Pedidri. And there is no chemical name of the drug.
As for its drug classification, its therapeutic classification is antifungal or antimyotic agent. As for its pharmacology classification, it is antifungal agent, imidazole derivative, antifungal agent, oral non-absorbed or partially absorbed, antifungal agent topical, antifungal agent vaginal. As for its pregnancy category, it is under pregnancy category C because animal studies have shown an adverse effect or there are no adequate studies in pregnant women or no animal studies have been conducted and there are no adequate studies in pregnant women.
The mechanism of action of the drug. The topical antifungal drugs work to alter the cell permeability of the fungus, causing prevention of replication and fungal death. The molecule has a high affinity for ergosterol present in the fungal cell membrane and combines with it in such way to take a micropore. The basic mechanism of the drug is to disrupt the cell membrane. It is fungicidal at a high and fungistatic at low concentration.
As for its pharmacokinetics, these drugs are not absorbed systematically and do not undergo metabolism or excretion in the body. And since topical antifungals are not absorbed systematically, they say pharmacokinetics are unknown.
The drug's indication. They are indicated only for local treatment of mycosis, including tinea infections. The topical application of the drug is useful in treating tinea pedis, ringworms, automycosis, and oral or cutaneous vaginal candidiasis. It is the preferred drug for treating vaginitis because of a long residual effect after a once daily application. The drug is also combined sometimes with glucocorticoids, which are inflammatory in nature.
The drug's contraindications. Contraindications are limited to a known allergy to any of these drugs and open lesions. Iconazole can cause intense local burning and irritation and should be discontinued if these conditions become severe. Gentian violet stains skin and clothing bright purple. In addition, it is very toxic when absorbed, so it cannot be used near active lesions. Naftifine, oxysanozole, and sertasonazole nitrate should not be used for longer than 4 weeks due to the risk of adverse effects and possible emergence of resistant strains of fungi. Terbinafine should not be used for longer than 4 weeks. This drug should be stopped when the fungal condition appears to be improved or if local irritation and pain become too great to avoid toxic effect. And efisonazole must be applied with a supplied flow through brush applicator.
Side and adverse effect of the drug: irritation, burning rash and swelling, nausea, vomiting, lower abdominal pain, hepatic dysfunction or urinary frequency, burning and change in sexual activity.
Nursing responsibilities before administering the drug. A nurse should be certain of the identity of the patient before administering a drug and confirm this with the wristbands and ask the patient for their name and date of birth, as well as ensure that the patient is not allergic to the drug. The nurse should have a clear knowledge of medication to be administered, which is the topical antifungal, its medical use, regular dose, reported adverse effect, and any specific contraindications or precautions associated with the drug to prevent any untoward complications. The nurse should also be familiar with the treatment plan of the patient and the need for the drug to be administered to the patient and perform a thorough physical assessment to establish baseline data before drug therapy begins to determine effectiveness of therapy and to evaluate for occurrence of any adverse effects associated with drug therapy. The nurse should also consider the dose, the route, and pacing recommended and equate this with their understanding and experience. The nurse should verify the drug's expiry date, provide thorough patient teaching including the drug name, prescribed dosage, measures for avoidance of adverse effects and warning signs that may indicate possible problems, instruct patients about the need for periodic monitoring and evaluation to enhance patient knowledge about drug therapy and to promote compliance. Also assess for any known allergies to topical antifungal to avoid hypersensitivity reactions. Also, perform physical assessment to establish baseline data for the evaluation of the effectiveness of the drug and the occurrence of any adverse effects associated with drug therapy. Perform culture and sensitivity testing of the affected area to determine the causative fungus and appropriate medication. Inspect the area of application for color, temperature, and evidence of lesions to establish a baseline to monitor the effectiveness of the drug and to monitor for local adverse effect of the drug.
Nursing responsibilities during administration: provide thorough patient teaching to enhance patient knowledge about drug therapy and to promote compliance with the drug regimen. Provide the following patient teaching. First is the correct method of drug administration. Demonstrate proper application. Second is the length of time necessary to treat the infection adequately. Third, use of clean, dry socks when treating athlete's foot to help eradicate the infection. Fourth, the need to keep the infected area clean, washing with mild soap and water and patting dry and keeping the area dry. Fifth, the need to avoid scratching the infected area. Use of cool compress to decrease itching can be advised. 6. The need to avoid occlusive dressings because of the risk of increasing systemic absorption. 7 is The importance of not placing the drugs near open wounds or active lesions because these agents are not intended to be absorbed systematically. 8. The need to report severe local irritation, burning, or worsening of the infection to a healthcare provider. Provide safety measures to prevent injuries. Ensure that the patient takes the complete course of the drug regimen to achieve maximal results. Instruct the patient in the correct method of administration depending on the route to improve effectiveness and decrease the risk of adverse effects. Troches should be dissolved slowly in the mouth. Vaginal suppositories, creams, and tablets should be inserted high into the vagina with the patient remaining recumbent for at least 10 to 15 minutes after insertion. Advise the patient to stop the drug if a severe rash occurs, especially if it is accompanied by blisters or if local irritation and pain are very severe. This development may indicate a sensitivity to the drug or worsening of the condition being treated. The administration of the drug should be reported immediately in a patient's note clearly and accurately, with the nursing signing and printing their name and documenting the date and time the medication was administered. Nursing responsibilities after administration. First, monitor patient response to the drug, alleviation of signs and symptoms of fungal infection. Monitor for adverse effects such as rash, local irritation, and burning. Evaluate the effectiveness of the teaching plan. Patient can give the drug name, dosage, possible adverse effect to watch for, specific measures to help avoid adverse effects. Monitor the effectiveness of comfort measures and compliance with the regimen. Offer support and encouragement to help the patient cope with the disease and the drug regimen. And lastly, after prescribing the drug, the nurse should complete the necessary works.